Hi! I have a surprise for you. Are you excited? It's measles. It's all the rage now. What? Did you want mononucleosis instead? Hello and welcome to the Standard Time Talk Show. I'm your host, Zsófi Papp. Let's get into it. It's been 5 years since COVID-19 took hold of our entire lives globally, and we're still wondering how it even started. We have two theories rummaging around. One would be, according to an article by The Economist in 2022, it began in a market in Wuhan, China, because someone seems to have eaten a bat. I still wonder what bats taste like, but COVID really kind of spoiled that for me. And the second one is that it was a leak from a laboratory in Wuhan, which was not far from the market. The second theory is backed up by the FBI and Germany's foreign intelligence, who believe that, and I quote, there was an 80 to 90% chance that coronavirus accidentally leaked from a Chinese lab. End quote. I'll be totally honest, I don't care all that much about where it originated. There are 1,000 factors we have definite information about and should contend with, so instead of theorizing and possibly even slipping down the route of conspiracy theories, I suggest we look at the things we already know. So many diseases have been transmitted to humans by animals, and some of them are taking the rounds right now. The Hall of Fame includes the Great Influenza of 1918, caused by birds, and Ebola, discovered in the mid-1970s. According to the WHO, the Ebola viruses belong to the family of the Ortho-Ebola virus, and fruit bats are its natural hosts. Damn, bats! I mean, they're cute, and they eat mosquitoes, which is among the best traits in any living organism. But why can't they just wash their hands properly? Of course, the animal-to-human pathogen all-stars are dominated by such legends as the plague and tuberculosis. And despite the advances in medical science, the latter is still going strong, mostly because there are now antibiotic-resistant versions of the bacteria, and even though we have medications for those are not available to a lot of people who need them. Bats, rats, and fleas in fleece, the loss of natural habitats significantly raises the risk of diseases being transmitted from animals to humans. Biodiversity is key if we want to prevent pandemics because, and I quote here, individual pathogens have fewer chances of establishing themselves in a diverse natural environment. In a sense, the COVID-19 pandemic of 2020 gave us a masterclass in epidemiology. The disparities between the wealthy and the most vulnerable of our society was made brutally clear. And who was your political leader at the time made all the difference. Forbes made an interesting observation during that time, asking, what do countries with the best coronavirus responses have in common? Women leaders. In an article released in April 2020, Forbes praised 7 female leaders who showed us what it takes to manage a crisis. Being truthful was essential. Angela Merkel talked sincerely and calmly about what measures needed to be taken and how serious the situation was. Decisiveness was another key factor, as Taiwan's Prime Minister Tsai Ing-wen made clear. She was one of the fastest acting politicians, introducing 124 measures without having to resort to lockdowns and sending 10,000 face masks to the US and Europe. Thanks for that. Iceland's Prime Minister Katrín Jakobsdóttir offered free coronavirus testing to all citizens, and Sanna Marin, the world's youngest PM at the time, was using social media influencers to help her citizens stay informed about the measurements of the virus, since not everyone reads the press. Norway's Prime Minister Erna Solberg even made sure to talk directly to children, holding press conferences where no adults were allowed, telling them it's okay to be scared. I wouldn't argue that compassion and responsibility are inherently gender traits. I also don't think that being reckless fools is an inherently male trait, not even when looking at Donald Trump and Boris Johnson. One thing that's sure, however, is that the pandemic and the subsequent lockdowns took a much higher secondary toll on women and anyone in caretaking roles, instantly plummeting their employment opportunities and income. This proves that epidemics are not strictly a medical, but a social, political, and cultural phenomenon with long-lasting implications. Of course, prevention is always much more effective than treatment, and vaccines play a crucial factor in this story. Vaccination has been key in eradicating polio, pushing down infectious diseases like smallpox, and of course the all-time favorite decimating animal life since the dinosaurs, tuberculosis. And despite the fact that safe and proven inoculation has long been available for a whole plethora of infectious diseases, here we face a cultural factor. As vaccine skepticism rears its ugly head, we see the rise of long-past pathogens like measles showing up again. The United States has a vaccine skeptic in charge of their health administration. Robert F. Kennedy Jr. doesn't believe in pathogens and has been peddling disinformation and health hoaxes for years. He also seems to bathe in sewage sometimes. His appointment as health secretary of the Trump administration is surely great news for fans of dying from preventable illnesses for the sake of stupidity, probably no one else. And the stakes are high. Bird flu and mouth and hoof disease are doing the rounds across our continents. Mpox seems to have been successfully contained, but other sexually transmitted diseases, for instance, antibiotic-resistant gonorrhea, are rising year upon year, and it doesn't seem that our societies are keen on implementing the lessons we should have learned from COVID-19. What have we forgotten, and how could we prepare for future diseases? Carola Marquina is a licensed psychologist from the University of Lima, specializing in the clinical field. She provides support to individuals in need. She's passionate about understanding the human mind and is deeply committed to serving society. Miriam Lindner is a nurse based in Vienna, Austria. She has been working in hospitals and emergency rooms. She completed her nursing education during the COVID-19 pandemic, gaining valuable training under challenging circumstances. Nevena Mitranić is an assistant professor at the Faculty of Philosophy at the University of Belgrade. She works on national education projects and researches preschool pedagogy. Her main focus is the importance of play in early childhood education, including in the pandemic. Today we are hosted by Foto Media podcast studio in Novi Sad, the courtesy of Open's Youth Center in Novi Sad. Hello, welcome, and thanks for taking the time to talk with me today about one of my favorite topics to dread, epidemics. So let's start with Carola, who is in Peru, works in Peru, and Serbia, Hungary, and Peru are very strong contenders in terms of pretty bad performance during the COVID-19 pandemics. Peru had the highest rate of deaths per capita. Serbia and Hungary were contending for the European prize. I think we took it, but don't take it as a personal insult, please. So you looked at how humans coped through lockdowns and through all kinds of pandemic-related restrictions. What have you found, Paula?
Hello, nice to be here. Peru had a lot of increase of debt. I think maybe it's because of our weak healthcare system. So workers are informal, so they couldn't afford to stay home during the lockdowns. So that was a factor. We also have our crowding and poor infrastructure. So many families live in crowded homes with limited access to clean water.
That's interesting to compare because as much as I understand, Serbia and Hungary started to perform really well in the later half of the pandemic. So after like the initial first half year, there was a bit of a breather during the summer times, and then the fatalities started to rise. Do you have any suspicion why this happened specifically in Serbia?
Well, I'm definitely not an expert on this part of topic, but I believe that we also had maybe a bit more problem of infrastructure than with the denial, because quite quickly we did understand that we are in a problem, and we quite quickly went into the lockdown, and people were disciplined in the beginning. But late, I believe that hospitals couldn't really cope with the number of people that were hospitalized, so that we didn't really manage that well.
It's tough to bring in Austria here because at some point being employed in Austria, I stopped telling my friends in Hungary about the rules and regulations and the 90% salary subsidy that you would get if you had to stay home, whereas in my country there was zero, like literally zero. But Austria seems to have done quite exemplary. Miriam, why is that? Apart from the fact that Austrians seem to have an innate love for rules and regulations, which they do.
I am a nurse from Austria, and I can only say that I think that Austria performed quite well, at least from European standards, because we reacted quickly. We had a very quick lockdown. Also, schools and universities were closed down within the first week of the first cases of COVID that were reported in Austria. And a lot of people were angry about that, and a lot of people said that that was unnecessary. I bet that you also had this experience in your countries. But in the end, it really paid off. And although we also had casualties, of course, also people did also die here in Austria. But I guess we kind of kept the casualties quite low.
My impression is that now that COVID-19 mentally is over, it's not over, it's doing the rounds and there's ebbs and flows in its spread. The two of you, Carol and Nevena, you have studied in detail its effects on different groups of society. Let's start with you, Nevena, because you specifically studied play and game playing in children who were, let's be honest, probably the worst affected.
They were the worst affected. We were one of the very rare cases of consulting with children of young age. Mostly researchers consult with parents, teachers, but children are not included. And when we talked with children about their experience of this period, and we talked specifically about education, we got to the idea that maybe they are mostly impacted not by the virus, not by deaths, not by the seriousness of the situation, but because of the fact that they lost every possibility for contact with their peers and with their teachers. The entire system was behaving like we must go back to the normal as soon as possible. And we treated children like nothing's going on, we just have to keep on with education. So it's kind of lost period for children.
Out of all the age groups, younger and younger children were dying less, so we didn't quite focus on them as opposed to typical children's infectious diseases, which are very sort of emotionally straightforward.
During the lockdown, children didn't have any sort of contact with anyone, and when you bring them back to the kindergarten, we opened it under very strict boundaries of view, and it kind of left children without all the things that are important for their learning and development. And for young children, the most important things are relations with other people, hands-on experiences, and all of that was kind of stripped down.
Despite their concentrated efforts, there's also a huge academic lag, which some students have amassed, not everyone. My impression back then, as just an angry parent, was why do we even pretend that there's school going on? What have you found, Carola, studying academic performance?
I studied here in Peru about stress. So I came to the conclusion that, well, there was a lot of stress factors in here. So there was a lot of tech issues, lack of focus because everything was going on here. Everybody was at home and it was hard to students. I was a student when COVID was happening here. So I can tell it was very stressful. We have also social isolation. So it reduced peer support. So people on the university, they couldn't relate. We also had the academic and financial uncertainty because of so many people were losing their jobs. So yeah, we have also exacerbation of current psychologist challenge as such as stress, anxiety, depression.
It's nice that there was a campaign banging pots and pans for essential workers, and there were individual fundraisers, and some people were really doing their best. But then it always comes back to the question, should individual effort compensate the failures of a wholesale system, and in some cases a system that is run by the state and has huge blind spots, a system that's partially privatized, and then that's a whole jigsaw puzzle in and of itself. So I wonder whether you would want to reflect on, especially Carola and Nevena, on this notion of the essential workers. Nevena, here.
Well, I really like that you brought up this question of making systemic issues an individual effort. Like, we all talk about the importance of essential workers, but their position here in Serbia actually didn't change. And for example, some sort of essential workers were also educational workers because they had to continue working with often very low ideas of what should they actually do in this situation, and their status after pandemic and till this day today is very, very bad. Miriam mentioned this mental health issues and different issues that we take for granted, and we should learn not to take them for granted. And I don't think that people are issue here, but the systems are issue here because they are still taking all of that for granted.
My impression is that oftentimes, the more crucial the type of work you do, the less appreciation there is socially. And this is a political sort of ranking system, right? So who's the most essential person in a school or in a food processing plant or in a hospital? It's the cleaners, without whom immediately everything goes awry, right? And they have the lowest salaries, the lowest ranking, often the fewest protections, they're often not regularly employed, and then we can go on like this. This also applies to nurses and all health practitioners in the sort of sibling professions, that they are organized in this military unit logic where the doctor is the commander and everybody is a subordinate, whereas sort of the day-to-day running, the real actual connection with the people there, without them, nothing would work.
I also agree with you definitely that the most crucial people in a system are definitely cleaners. So I was lucky to have had 2 workplaces. One of them I am currently in, where the opinions of nurses are valued, and especially because we spend the most time with the patients. So we know how the patient looks like, how they feel like, what their vital signs are, what they say about their health. But of course, there is this notion that doctors say what they want or what they think is best for the patient, and then the nurses, they are just doing their part and administering the medicine or the treatment. It's super important that we work together in order to see the patient as a whole. Also, maybe they also know what is going on in their personal lives and how we can treat them in the best way possible.
Very happy to hear that, and I can confirm from my personal experience having an Austrian insurance for the 7th year, that's a whole different universe to what I'm used to. I wonder, Carola, whether you would tell us about informal workers in this regard, because I think the issue of employment and labor and people needing to make a living is very high on the agenda when we talk about social distancing, quarantines. Even the idea of some kind of healthcare discipline is contingent on whether people can actually execute it.
In the health area, well, we have poor staff of workers. So because also we have informal workers on the pandemic, we had to go outside and work because we have a lot of daily people who works and have their money day by day, so they had to go out. So that was a factor who increased the COVID and the sickness because were spread for everybody.
Vox Femine is a queer feminist media platform from Croatia that highlights marginalized perspectives often ignored in mainstream feminism. It centers on trans liberation, feminist abolition, and systemic oppression using articles, interviews, and pop cultural analysis to challenge dominant narrative and promote justice-oriented language. Check them out, voxfemine.net. Thank you. We had a previous episode quite some time ago about sexually transmitted diseases, which have been steadily on the rise for almost 20 years now, all across Europe and much of the Americas. They're heavily attributed to lack of information and the misunderstanding that with the highest wave of the AIDS epidemic gone, the danger would be over. Or still in the COVID-19 lockdowns, Mpox surfaced. And interestingly, we saw a very concerted and I would say extremely disciplined effort to deal with this. And of course, sexually transmitted diseases are very different to respiratory ones that you can catch just being in a room. Miriam, can you tell us about how we can learn from one kind of epidemic in regards to another?
I actually saw this episode and I liked it a lot. So I currently work in a clinic where STDs are tested and treated, and I also work with HIV patients. And so I can tell you a little bit about how I perceive the situation. Honestly, about Mpox, I haven't seen a lot of cases, and I'm not sure that in Austria it was really such an issue. Mpox has a very specific presentation, and patients tend to go to the doctor very quickly in order for them to get treatment and, of course, not to give the disease to someone else. For example, gonorrhea has also been on the rise in Austria. And we see a lot of cases every day, and we treat a lot of cases. And on the other hand, for example, HIV, the HIV contractions have gone down, fortunately. To answer your question, I think it would be good to inform everybody about safer sex practices and to make this more of a topic, because, of course, a lot of STDs are treatable, but they still have an impact on your health, of course. And we need to take that down a notch a bit. I feel like that. Yeah.
I love to talk about gonorrhea, and especially super gonorrhea, because it freaks everybody out in the room, and then that masks my ever-perpetual internal horror that I go through life with. So that's a good averting strategy, and also a little bit of information dissemination.
Yeah, I feel like I'm a bit scared of antibiotic resistance. The more treatment that we administer, the more likely it is for patients to develop resistance, just like with any other antibiotic or disease.
So antibiotic-resistant tuberculosis is on the rise, and tuberculosis actually weirdly never went away, which John Green recently published a phenomenal book about titled Everything is Tuberculosis, which traces this million-year-old disease which had been found also in dinosaur remains, so has been around for a while, across human history. But there's also closer to home, simply because in Europe we quite heavily vaccinate against tuberculosis as well, so that's an advantage. But there's mouth and hoof disease all across Europe that keeps us quite scared, and a lot of livestock being slaughtered. There's bird flu, especially in the Americas, spreading right now. Do you think that there is already a new sort of human-affecting pandemic in the making? And do you think that there's any way that a society can consciously, instead of panicking, properly prepare for a case like this?
Unfortunately, this was not the last pandemic to come. We cannot really avoid having another pandemic at some point, but I just hope that it won't be as impactful as COVID, and maybe we can learn from that to eat more plant-based products and not a lot of animal products, in order to have less breeding associated or food industry associated pandemics, because I think right now there's also like the bird flu is also associated to food industry, and also COVID was originated from some kind of food market.
Yeah, I think also in the COVID-19 pandemic, we saw that industrial farming and meat processing itself are huge vectors and very problematic. You studied specifically play in young children and its role during the lockdowns and coping with the lockdowns. So, drawing on this expertise, how did you see these kids coping, and what should we learn for a potential next round should it ever surface?
Well, what I actually studied was play between children and adults, because we tried to, in this whole scenario where teachers just give children different tasks to do from home, we tried to actually provide them with different sort of opportunity for experience with their parents. So we gave them different examples of different games which are easy and catchy, and parents can easily play them with their children, just to have some quality and nice time without any sort of pressure. And it proved both for children and for adults that that was something meaningful for them. Like, for example, when teachers gave them different tasks that demanded focus on content, for example, they would learn about virus, about health of the lungs, about how to wash their hands. When we talked with children about those tasks, they were children missed what was the point of it. And although it sounds as it is relevant for us as adults, it wasn't kind of close to their experience. But whenever they had the opportunity to engage in some tasks that demanded for them to share with someone or to show something that they've learned and that they like to other people, they really enjoyed in it. And it kind of proved that play, both for children and for adults, was not an activity for relaxation, but it was kind of a space when we can get together in a different way and find something vital and nice in a situation which is very stressful for all of us. When you mentioned in this previous talk the lack of information that we often have, which brings us to pandemics and disasters as such, with COVID it might not be the lack of information but disbelief that we had, because systems are not something that we quite easily believe today, and they do not really deserve to be believed very often. So politics that are happening in our era are mostly affectionate and mostly not really rational. So to fight them and to find different ways to engage in the political resistance demands some sort of effective work as well, and not something rational. And I think that play really provides us with that sort of space, like space where you are free to really take a critical stance in a different manner and to engage with other people on some different basis than in everyday life. So that's why I think play is important, not just as an activity or easygoing solution for spending time when times are difficult.
Playing with your kids is so hard. Like, I was brought up in a family where playing was like, we're gonna play a new game today. It's called shoveling. It's an agricultural family. And so when we were stuck home with the kids, they were supposed to do homework, which some of them just couldn't. And I was not really forcing them to do. I was like, okay, I mean, you can knead dough with me, or we can play cleaning the bathtub if you like. But, so this actually learning to play with your kids, it has been a sort of generational hardship for me, I admit.
Yeah, but a part of the problem was that kids had to do their homework. They had to finish their school years.
I still don't understand why.
Yeah, like everything is collapsing, but we have to get our grades at the end of a school year. And we kind of understand that you have emotional struggles, that it is tough for you, but you will still have to do your homework. And that's kind of a schizophrenic thing on a systemic level.
I want to bring up something about teleworking, which you have been studying, Carola.
As we are now doing this conversation, the pandemic led us to be here, like to understand a new world, a new way to interact, and it also connect us. It connect everybody from all around the world. So before we didn't think that it would be a reality. We can learn from with a computer. We can learn with classes online, and we also can work online. We found ways, creativity ways to face challenge and keep going. So yeah, I think this lockdown was in a way positive.
Finally, a positive side, but I want to bring in, I want to come back to labor because usually that's all I think about. There's a crippling shortage of healthcare professionals as well as teachers and all kind of pedagogical workers all across Europe and the Americas at least, but frankly globally. There's like a huge brain drain of professionals. Where I'm from, entire classes of nurses get their degrees and emigrate together as a class to, say, Norway from Hungary and things like this. Are there really not enough professionals, or is it the circumstances? How do you see this?
At the moment, I agree that there are not enough professionals to cover all the needs that we have as a society. I'm talking about Europe, Central Europe, also about Austria, because the population gets older and older, and also, quite frankly, sicker and sicker. Maybe we need to focus our efforts on prevention more than treatment. I think that 10 years ago, being a nurse was something that a lot of people aspired to. And right now, there's not a lot of young people that want to do the job. I'm not really sure why that is, but maybe we need to highlight the positive aspects of the job more instead of saying, oh, we work such long hours for no money, and it's actually kind of frustrating because it is a beautiful job and I like doing it. And maybe we need to, because we've had that in Austria, we've had campaigns saying what nursing really means. It doesn't only mean washing somebody or helping them in their daily activities of life. It means to listen to somebody, to know the life story of somebody, and to be at their side when they have a difficult diagnosis. And that is the beautiful thing about the job. And you need to have more skills than medical skills and resilience. You need to have a lot more. And
yeah, but also maybe some better salaries would actually help.
Of course, that's what I wanted to say for last. That is, of course, a big aspect of fair pay, a fair salary. I'm not talking about asking for too much. I'm talking about just asking what we need to do that job, and in order for it to be compensated fairly, because it's very hard work. It's actually one of the hardest jobs.
Our media partner Átlátszó is a Hungarian watchdog journal who is under very serious attack. They have been under a lot of political pressure for years on end. They work on freedom of information, access to public information. They investigate and report on cases of corruption. And you wouldn't guess, but for this reason, they have practically been in the focus of the Hungarian government trying to repress independent media. There's a new law being introduced that penalizes foreign funding that affects Átlátszó deeply, simply because the remainder of independent media in Hungary has sustained itself in a large part with external funding after local available funding has been monopolized by the government. Please get informed about these laws being introduced and check out Átlátszó's videos on, say, lithium mines in Bosnia and Serbia, or the scandalous and disastrous Belgrade-Budapest train line, and all the more on YouTube. Thanks. Nevena, how do you see this shortage of pedagogues, which is quite an issue all across Europe, and Serbia, as much as its entire region, is struggling with huge outmigration?
Well, not just migration. I think that we in the region have a lot of issue with really not being valued for working with children. Either you're working with older children or smaller children, and especially when you work with the young children, they see you as just taking care of kids and playing with kids and not really being a profession.
I'm also a teacher by training.
Yeah. So you tell us what.
Well,
I mean, that may not be the only profession I abandon very soon now. Being a journalist, going back to Hungary, very encouraging, I have to say, but that's beside the point. I wanted to ask all of you, as sort of round of closing remarks. So, is there something that the general public could do or aspire to that would help us either prevent a next pandemic or cope with the next, or even epidemic?
What we learned of COVID-19, we can now do better on mental health. So I think students' well-being is as important as academic performance. So I think institutions should integrate mental health services into their core support systems. Is a reality that we have to be more flexibility in education is very essential on that. We can do now online and hybrid learning options. I think we can also be better on digital inequality here in Peru.
Thank you. Miriam, what do you think? Is there some kind of a preparation that we could do? I'm a prepper, I admit. I'm not the camouflage and shotgun type of prepper. I'm more the mason jar type of prepper, as you can see from the cucumbers behind.
So are you also the one that would buy groceries and then keep them in a box in the cellar, or would you like?
No, I'm a peasant. I keep them in mason jars in the cellar on shelves.
I agree, and I think about what everyone can do in their daily lives is just go back to basics, practice hygiene, like disinfect your hands, disinfect. I don't know, maybe wash your hands when you come home. I mean, those are very basic things, but I think they are super important. Also, wear a mask when you are sick in order to protect children or elderly people or people with a conflicted immune system. Also, think about vaccines, of course. This is a very controversial topic, but vaccines do make sense, and we should all think about how to protect those that don't have a functioning immune system.
Thank you, and I'm so glad you brought up vaccines, because this is a highly contested topic right now, especially with the changes in the US, which are, from a World Health perspective, are quite devastating. And they have been in the previous round of a Trump administration. But right now, there's an actual lunatic serving as the Secretary of Health who doesn't believe in vaccination whatsoever. And now kids are dying of measles, which is a 100% preventable disease. So I think that's an important point to address there. Maybe if I can press you on this a little bit, how do you see global health faring now with these changes in international politics? I know this is not your expertise, but you are a practitioner in the field, and I'm pretty sure that your work is affected by how much actual cooperation or withdrawal of funding in, say, research or even in base work is around you.
So that is a tough question, because I think, as you mentioned earlier, research on vaccines was quite well financially supported when we faced the pandemic. And as we saw, it helped. So the vaccine saved us, kind of. And I think people have forgotten how there were other pandemics in the past. For example, measles. Children have died in the last 100 years or longer of this disease. I think that the pharma industry is always well supported, which can be good and bad, of course, because of course we need medication and we need to treat diseases. But I think the focus should be placed more on prevention than actually treating diseases, for example, heart diseases and diabetes. Those are the most common diseases and death causes in Central Europe, also in the Americas. And we can prevent that by making healthy life choices, and that doesn't even cost anything. So maybe it would be better to get funding for preventative programs like maybe dieting counseling and yearly health checkups. We have that in Austria, and a lot of people use it, but I'm not sure if everybody is using it, and it should be part of our daily health routine to do that.
Nevena, is there something you see to sort of epidemic-proof education, especially early childhood education, which is arguably the most decisive factor in the academic performance of every child?
Well, I'm thinking about this question since the beginning in a bit broader sense, not just by epidemic or different sort of medical conditions, but any sort of crisis. And unfortunately, here in Serbia, we face two difficult social crises, one currently going on, since the pandemic, and they both hardly impacted education. And I'm thinking, did we actually learn anything about how to deal any sort of crisis? Because if I should give any sort of advice to broader public about how to treat this sort of situations, is just not to fall into panic, because very often we fall in this sort of fear and just try to rush through it as fast as possible. And I'm thinking about this question of Trump's government that you mentioned with Miriam, and how often we give our trust to people as such because we are afraid and not because of the rational motives. And we very often get very bad decisions out of fear and anxiety, and that's something that impacts education quite heavily in this crisis situation. So just to take things more slowly and to stay a bit longer in difficult periods of time, just understand what's going on to us and not to rush through them. That would be like maybe the best advice.
That's awesome. Thank you so much. Do you like pickles?
Yes.
Will you accept this from me?
Thank you.
Thank you so much. Thank you, ladies, so much for joining us.
Now we want to know, what have you learned from COVID-19? What have we forgotten about? Share your thoughts in the comments, and don't forget to like and subscribe. That helps us a lot. This show is brought to you by Eurozine, a free online magazine offering deep insights through articles from over 100 journals across Europe. Powered by Display Europe, a platform for multilingual content on European politics and culture, this project is co-funded by the EU and the European Culture Foundation. Neither the European Union nor the EACEA can be held responsible for any of the views or opinions voiced in these episodes, though. Wash your hands.